The National Academies of Sciences, Engineering, and Medicine published the results yesterday.
There are risks. They were most concerned, or one of the large areas of concern was with adolescents, right? The earlier you start using it, the greater the concern.
We did find that cannabis use prior to driving increases the risk of being involved in a motor vehicle accident.
What we're seeing a lot of in the emergency department are complications from marijuana. If we see overdoses, it's almost always edibles because they eat them, they wait a half hour, they don't feel an effect, they eat some more. Now they take a third dose, and by the time it all hits, they're just, high as a kite, paranoid, screaming, seeing things.
I, for example, worked New Year's Eve into New Year's Day, and already we were seeing patients that night in our emergency department with symptoms. So there's certainly been an acute uptick in recent days.
A 4-year study at the University of Colorado Hospital in Denver showed marijuana-related emergency room visits tripled after the state became the first in the country to allow recreational sales, seeing on average 2 to 3 patients a day with severe vomiting, anxiety, and psychosis, amounting to more than 2,500 visits at this one hospital alone. There have also been 3 deaths linked to edible THC products in the state. In Massachusetts, doctors say calls to the state's poison control centers have doubled since marijuana was legalized there. Emergency rooms seeing a dramatic increase in pediatric cases.
With our adolescents, marijuana is actually the primary drug of choice that they identify in walking through the doors in our treatment. And in addition to that, if we look at all of our patients overall, from adolescents all the way through older adults, about 50% of our patients identify marijuana as one of their primary or secondary drugs of choice.
There is no doubt a trend happening in states that have legalized recreational marijuana. There's an increase in adolescent use and an increase in young adult use.
There's certain areas of the brain, particularly in the prefrontal cortex, the frontal area of the brain, that are associated with cognitive control, decision making. So really important skills, especially for young people as they're learning and make decisions in their lives. And those areas of the brain don't really fully mature until actually the mid-20s.
Patients have a history of asthma. Smoking marijuana can actually make the asthma worse. There actually are also a lot of carcinogens or cancer-causing compounds in marijuana, and so there are also some of the same theoretical risks to smoking marijuana as there are to smoking cigarettes with respect to development of lung cancer.
Do we know enough about its long-term effects, especially on teens and kids' brains? There's some legitimate concerns.